Can the drugs used to treat erectile dysfunction also lessen the risk of Alzheimer's disease? That's what a new study in neurology is suggesting. And senior health correspondent Monica Robbins joins us to explain. Hi, Monica.
Hey, Isabel. Yeah, it's a big question. So erectile dysfunction drugs are vasodilators, meaning they open blood vessels. As a result, blood flows more easily. So while we know vasodilators may help prevent stroke and potentially cerebral small vessel disease, preventing Alzheimer's, that's a big jump. The study does not prove that erectile dysfunction drugs reduce the risk of Alzheimer's, but it shows an association. Now, the study followed 270,000 men for about 5 years. Half of them took ED drugs, and they found those who took the drugs were 18% less likely to develop Alzheimer's. However, this study was also based on prescription records, meaning researchers didn't know if the participants actually filled the prescription and took the drugs.
Aging is the #1 risk factor for Alzheimer's. So it would be very hard to demonstrate a causal relationship between the ED drugs and the development of Alzheimer's disease. So we have to understand that, okay, that's going to be both a hard thing to prove and a hard thing to disprove.
Now, Dr. Duffy added that ED drugs could alter brain blood flow, and that could decrease or increase the risk of developing Alzheimer's. He noted that this was not a randomized control study, and there are so many other factors other than the ED drugs that may have helped prevent Alzheimer's. Now, he said, keep in mind, if the FDA ever approves drugs for Alzheimer's, especially ED drugs, then you'll have your credible evidence. So don't read too far into the preliminary findings. Much more research is definitely needed. Meanwhile, get your weight, blood pressure, diabetes, and cholesterol under control, because if you have all of those and they're out of control, those things combined can definitely trigger Alzheimer's development, Isabel.
Yeah, good information there, Monica. And I have to circle back to this morning's pitch meeting. That's when we all kind of sit around and talk about our story ideas, because you brought up Alzheimer's and a relation with picking your nose. I have to ask, what's going on?
There's actually a study out about that one, and I will bring that to you in just about 40 minutes at 5 o'clock.
Oh, what a tease. Okay, I know you'd stay on top of that, Monica.
Sure.
Thank you.